This is Dr. Clive Persaud, double board certified cosmetic surgeon in Tampa, Florida. Today we're talking about capsular contracture. So any foreign body, whether it's a pacemaker, hip, knee, or breast implant in our body gets walled off and that forms a capsule. When that capsule becomes hardened, it's called capsular contracture. This usually occurs because of some kind of introduction of bacteria, whether it's during the placement of the implant itself or long-term, some kind of systemic illness, whether it's allergies or the common cold or flu, can also cause that capsule to be hardened. Now, definitive surgical treatment for capsular contracture is surgical resection of the capsule as well as taking out the implant. However, there are non-surgical ways to treat capsular contracture in order to avoid that definitive surgery. So for those non-surgical options, I'm going to turn it over to Jenny at SkinSpired Aesthetics.
Thank you so much, doctor. So with capsular contracture, waiting too long after surgery can potentially make the problem worse and increase the need for surgical intervention to resolve the issue. So what I tell patients that come in is ideally, I'd love to get you guys in at the 2-week mark. And then from about 2 weeks until about week 8, depending on how sensitive you are, let's say the first week, we'll treat you for 1 time out of the week, and then thereafter twice out of the week, up to 3 times a week, depending, again, on the grade and sensitivity. That being said, we do need to hold an evaluation to assess everyone's individual needs. And on top of that, we like to communicate with your surgeon. We need to figure out what has your surgeon already put you on to prevent the scar formation from getting worse. From our experience, some of the surgeons will prescribe singular, MSM, or vitamin E. I personally like serapeptase for capsular contracture as well. So I really like this approach because whatever your doctor has prescribed for you to take internally, it's going to help with that scar formation. While we can come in on an external factor and really create that mobilization back into the breast. So we'll use 2 different sound therapies, decompression therapies, a lot of hand techniques. So at the bare minimum, you're looking at 10 sessions. After the 10 sessions are complete, we can reassess your capsular contracture and determine whether we need to continue with treatments or not. If you are on a grade 1 capsular contracture, we might start you off at 5 and then after the 5, reassess. If you are going in for revision surgery, you are at a higher chance of redeveloping capsular contracture. My recommendation would be do it as preventative. Just do the sessions once a week for 5 weeks as preventative. We'll treat both breasts so that it doesn't happen in either or. Thank you so much, Dr. Clive Persaud, for joining me in on this educational video on capsular contracture. If this video has been helpful to you, we would greatly appreciate it if you subscribe to our channel and give us a thumbs up. If you'd like to be in contact with us, Dr. Clive Persaud and SkinSpired Aesthetics, information will be shared in the caption below, as well as our social media links and how to communicate with us. Thank you guys. I hope to hear from you soon. Bye.